Today, we're going to break down a really powerful, evidence-based solution for one of the most terrifying things a person can go through, a panic attack. We're going to look at exactly how cognitive behavioral therapy, you've probably heard it called CBT, helps people get out of the suffocating trap of panic disorder with agoraphobia. It so often starts with a thought just like this one. Or maybe it's, I'm gonna die, or I'm having a heart attack. It's this internal scream that feels 100% real, and it's the trigger that can send someone spiraling into a full-blown panic attack. So to really see how this all works in the real world, we're going to walk through a case study. Theory is one thing, right? But seeing it play out in someone's life, well, that's when it all really starts to click. So let's meet John. He's 45, and his world has just become incredibly small. He keeps having these sudden, overwhelming waves of fear, these panic attacks, and they come with some terrifying physical symptoms. His heart pounds out of his chest, he feels like he can't breathe, and he's totally convinced he's about to die or just lose his mind. And because of that, he started avoiding places he can't get out of easily, like a crowded bus or the grocery store. This right here, this is the classic picture of panic disorder with agoraphobia. So what is actually happening here? For someone like John, it feels completely random, like a lightning strike out of a clear blue sky. But what if it isn't? The CBT model shows us that panic isn't random at all. It's actually a predictable, and because it's predictable, a treatable, vicious cycle. This panic trap really follows 4 distinct steps. It all kicks off with a totally harmless bodily sensation. But then, and this is the key, comes step 2, a catastrophic misinterpretation of that feeling. That scary thought is what skyrockets the anxiety, launching a full panic attack. And then finally, to stop it from ever happening again, the person starts avoiding things, which, ironically, is the very thing that keeps the whole cycle spinning. And here is that critical second step in action. You know that feeling when your heart skips a beat? Most of us just brush it off. But in this cycle, that becomes, I am having a heart attack. A little bit of lightheadedness from standing up too fast becomes, I am going to faint. See, this isn't just regular worrying. This is taking a completely benign signal from your body and interpreting it as proof of an immediate disaster. Now, to cope with this terror, people develop what we call safety behaviors. These are little tricks you do to feel safe, like always knowing where the exits are, or never leaving home without your pills, or only going places with a trusted friend. And they work, kind of. They give you relief in the short term, but here's the huge catch. They prevent you from ever learning that the situation wasn't actually dangerous. You start to think, woo, I only survived because I had my water bottle, not because there was never any real threat to begin with. Okay, so we've laid out the cycle that's trapping people like John. It seems pretty airtight, right? So the big question is, how do you break it? Well, this is where CBT comes in. It offers a systematic toolkit designed to take this cycle apart, piece by piece. And it all starts with knowledge, seriously. The very first step is what we call psychoeducation, where the therapist teaches the patient about the body's natural fight-or-flight response. Just learning that a racing heart and shortness of breath are just your body's alarm system going into overdrive, and that it's super uncomfortable but ultimately harmless, that is incredibly powerful. It starts to take the fear out of the fear itself. From there, the therapy pretty much splits into a 2-pronged attack. On one side, you have cognitive interventions. These go after the catastrophic thoughts. It's all about changing what you think. And on the other side, you have behavioral interventions. These go after the avoidance and safety behaviors. It's all about changing what you do. For the cognitive part, a really important tool is called Socratic questioning. Instead of a therapist just saying, oh, don't worry, you're fine, they help the patient become a detective of their own thoughts. They'll ask questions like these. Okay, what is the actual evidence that you're having a heart attack right now? Or could there be any other explanation for why your heart is racing? And a really powerful one. You've had hundreds of these panic attacks. What has actually happened every single time? The goal is to help you see the thought for what it is. Just a thought, not a fact. Okay, next up is the behavioral work. And this part gets really hands-on. Using a technique called interoceptive exposure, the therapy goes right after the fear of the bodily sensations themselves. The whole idea is to prove, through direct experience, that these feelings are just uncomfortable, they are not dangerous. So, for example, a therapist might actually have John hyperventilate on purpose to make himself feel dizzy, or spin around in a chair, or run on the spot to get his heart pounding. Now, I know it sounds totally counterintuitive, right? Why would you want to cause these feelings? But the purpose here is profound. It allows him to learn from his own direct experience that these sensations are just sensations. They feel weird, sure, but they are not dangerous and they always pass. So once John is less afraid of his own body's alarm bells, it's time for the final step. It's time to take these new skills out into the real world and start to dismantle all that agoraphobic avoidance. This is all about reclaiming the life that panic has slowly stolen away. And this isn't about just throwing someone into the deep end of their worst fear, not at all. It's done very gradually using something called a fear hierarchy that the patient and therapist create together. You start small, like maybe just standing outside the front door for 5 minutes. Once that feels manageable, you move to the next step, like walking to the corner shop. It's literally a step-by-step ladder back to freedom. And here is the absolute key to making this work. During these exposure exercises, the goal is to stay in the situation long enough for the anxiety to peak and then come down all by itself. No running away. And no using those safety behaviors. This is what allows for new corrective learning to happen. It's how you teach your brain at a really deep level that the terrible thing you're afraid of doesn't actually happen. So let's just quickly recap the core of what we've talked about. CBT for panic works by 1. Correcting those faulty, catastrophic interpretations of what's happening in your body. 2. It systematically helps you reverse the avoidance of all those feared places. 3. It helps you get rid of the safety behaviors that are acting like crutches. And most importantly, it makes all this happen through direct, hands-on, experiential learning. And you should know, this isn't just some interesting theory. We have decades of research showing that CBT is a first-line, gold standard treatment for panic disorder. It's incredibly effective. And, crucially, studies show that people who complete a course of CBT have much lower relapse rates than people treated with medication alone. Because CBT doesn't just treat symptoms, it teaches you skills for life. Ultimately, this whole therapy isn't really about getting rid of fear entirely, but about changing your relationship with it. And it kind of leaves us with a really powerful question to think about. What could any of us achieve in any part of our lives if we learn to treat our fears not as commands we have to obey, but as hypotheses that we can actually go out and test?